Story 1. This is not related to sickness but rather injury. After a certain age, which varies for everyone, you should remove all slippery socks, uneven area rugs, and any other tripping hazards in your home. It is very easy to trip and fall in the dark while trying to reach the bathroom, and many people experience significant complications when recovering from a broken hip or other leg injuries. Small trip hazards in your home may not seem like a big deal, but they can lead to injuries from which you may never fully recover, and this is a very common issue. Story 2. Untreated sleep apnea is detrimental to your health. Over time, it can lead to heart problems, diabetes, stroke, and even shorten your lifespan. Additionally, chronic lack of quality sleep can negatively impact your immediate mental and psychological well-being. Snoring continuously is not normal. Consider using a continuous positive airway pressure device. Story 3. If you have sudden unexplained weight loss, please get checked out. I cannot begin to count how many people, especially those who are middle-aged and older, I have evaluated for other symptoms who mention, "Oh, by the way, I've lost a certain amount of weight in a month." More often than not, it turns out to be cancer. You are not becoming a skinny legend. It's cachexia. Story 4. People with congestive heart failure are not checking labels for sodium content, and here in Louisiana, they are attending multiple crawfish boils. Story 5. Not brushing your teeth can lead to various health issues caused by mouth bacteria, potentially resulting in serious consequences. Story 6. Swimming with contact lenses can lead to serious infections. Every time I dispense fortified vancomycin and gentamicin eye drops, which are compounded in our 4-room, I find that the patient had been swimming with their contact lenses in. This practice can result in severe infections. Story 7. If your toes start turning black from untreated diabetes, it will not improve on its own. It will only continue to worsen and may lead to irreparable damage, including the complete loss of the foot. I am unsure if people realize that aspirating substances, which is commonly described as something going down the wrong tube, can cause pneumonia. Additionally, I can state that after several months working in X-ray at an inner-city level 1 trauma hospital, I will never get on a motorcycle, four-wheeler, all-terrain vehicle, or dirt bike. No, thank you, I am good. Story 8. Psychiatric nurse here. Don't stop your medications because you're feeling better. Why do you think you feel better? Story 9.1. Drinking can lead to cirrhosis, which is very harmful. Wash your hands thoroughly. I don't mean just a little squirt of soap followed by a quick rinse. Norovirus and Clostridioides difficile are serious, and trust me, you don't want to experience them. Story 10. I work at a dental office where I see people improperly taking or stopping antibiotics prematurely. When individuals start but do not finish their antibiotic course, often because they feel better, the surviving infection can develop resistance. This makes future treatments ineffective or completely unhelpful. Taking the entire prescribed course of antibiotics is essential. Infections in your teeth and jaw can quickly reach your brain. Leaving an infection untreated, especially if it is asymptomatic or not causing pain, can lead to bone loss, which significantly impacts dental implants and overall jaw strength. Story 11. Poor social support and relationships. Drug misuse and abuse without recognizing the harm. Never opening their blinds or sitting in the sunlight. Story 12. Do not let your dog lick an open wound. Their mouth contains bacteria. They do not have clean mouths like we were told as children. Additionally, please take your medications before coming to the hospital. Just inform us of what you took. There is no reason to skip your blood pressure medications. Bathroom injuries are common. I cannot tell you how many people come to the emergency room after fainting on the toilet from pushing too hard. Also, ensure your toys have flared bases. Story 13. I had a type 1 diabetic patient in medical school who stopped taking her insulin because she believed it would help her lose weight quickly. Her chronic high blood sugar levels eventually shut down her kidneys and caused her to go blind in one eye. Story 14. I have encountered many male patients with rectal issues due to not wiping after using the bathroom. One patient told me that it is inappropriate to touch oneself. Another mentioned that he simply does not wipe. Another said he did not care. These are completely preventable health issues. Story 15. not following advice such as reducing or eliminating certain foods from your diet or not exercising. Additionally, neglecting basic hygiene practices like washing your hands. Story 16. Finishing antibiotics. Always finish the full course you are prescribed. You may think you are better, but the bacteria may not be fully eliminated and could return stronger. Story 17. Pay attention when something changes or something new happens. Even minor issues that persist or worsen should always warrant a trip to the doctor. I am a medical student, and I delayed seeing a doctor for embarrassing urinary symptoms for 6 months. I finally visited a healthcare professional a couple of weeks ago, and they suspect I may have multiple sclerosis. I am frustrated with myself because, if I do have multiple sclerosis, I could have started treatment months ago and prevented ongoing nerve damage. Story 18. High humidity in a house causes mold. Not changing the air filter on your heating, ventilation, and air conditioning system regularly leads to mold and high energy bills. Story 19. Dermatology physician assistant here. Please moisturize your skin. Wearing lotion is not just a feminine activity. Dry skin can lead to itchiness, which can result in chronic itching, intense scratching, and can cause open wounds and sores. Itchy skin can be incredibly frustrating. I see it every day. The simplest way to prevent this is to use lotion. Story 20. Listening to influencers who are not medically trained. I have watched advertisements on TikTok where an influencer pours 2 packs of liquid into a cup to create a new flavor or whatever the raw milk and unpasteurized product is. You cannot remedy hyperlipidemia with lemon and cayenne water, but it can harm your gastric lining. Story 21. Long-term, low-grade stress is often overlooked. While large stressors and traumas can have severe effects, being consistently stressed over an extended period is even more detrimental. The epigenetic changes that occur can be significant and should not be underestimated, especially when considering the direct health concerns associated with chronic stress. Registered social worker and forensic psychology and neuroscience student. Story 22. Physician. 1. Alcohol consumption. 2. Obesity. 3. Indiscriminate use of over-the-counter supplements. 4. Motorcycles. 5. Failure to wear a helmet. 6. Not managing high blood pressure because you feel fine. 7. Neglecting dental care. Poverty. Story 23. Chronic reflux can cause cancer. Chronic throat clearing is not normal, especially after eating. Snoring does not equal sleep apnea. It indicates that you may stop breathing for periods while you sleep, which can lead to heart enlargement, high blood pressure, clotting, stroke, and more. Use your continuous positive airway pressure machine. If your blood pressure is normal, it does not mean you should stop taking your blood pressure medications. It means they are working. Extremely high blood pressure is not only due to stress or anxiety at the moment, it is likely happening consistently when not monitored, and that is not good. A single electrocardiogram or a week-long Holter monitor that does not show atrial fibrillation does not mean you do not have it. It may simply not have detected it during that period. These are just a few points to consider. Story 24. My mother kept getting itchy eyes and a scratchy throat. Mom, you're drinking stevia. You have a ragweed allergy. Stop drinking that. She stopped, and that was it. Keeps happening periodically. Mom, stop taking echinacea. You're making yourself sick. Mom, did you look at the label? This has stevia. Why, Mom? Story 25. Do not delay in seeing a doctor for any new concerns. I had a patient who effectively used their health insurance and managed to avoid several cancers. They only had to trade it for a few scars on their skin. It is remarkable how catching issues early can result in only needing surgery without chemotherapy. I have seen many others postpone medical care, which ultimately led to severe consequences, and some of them may face dire outcomes soon. They could have enjoyed many more years, but unfortunately, anxiety and fear can overwhelm us. Story 26. Hand hygiene and sleep hygiene are important. Do not share clothing, textiles, or materials with people you do not know. I work in a jail and once had an entire unit get pink eye. When I asked if they shared anything, someone mentioned that they all used one towel to wipe away their sweat while working out. He was horrified when I explained how pink eye is transmitted through fecal matter. Story 27. Consistently getting less than 7 hours of sleep, even if it is 6.5 hours, is enough to suppress your immune system. This is because deep sleep is extremely important for T-cell function, which involves cells that seek out and destroy infected cells in cancer. Chronic short sleep leads to more frequent infections, and it also takes longer to recover. Story 28. Ringing in your ears is not always an issue associated with aging, nor is it solely due to a lack of ear protection. Intracranial hypertension may be a contributing factor. However, it is still important to wear ear protection. Story 29. This is good advice. I am 43 years old and I tripped over an uneven sidewalk a few weeks ago. I am still dealing with some pain from it. I never realized how dangerous falls could be, especially for the elderly. Story 30. Not drinking water leads many people to feel unwell while relying solely on coffee, soda, and beer. Individuals in this situation live on the edge of minor dehydration, where even minimal exertion feels daunting. By drinking the water your body needs, you can alleviate various minor issues. Story 31. Not necessarily sick, but long car rides without brakes can cause blood clots, which may lead to a pulmonary embolism if left untreated. Story 32. I am not a medical professional, but so far, there have been 3 entirely unrelated people in my life who have casually gone out of their minds and then discovered black mold in their homes. For the love of God, if you start noticing someone has lost their grip, kindly encourage them to test for black mold. If it's not that, their thyroid may be causing issues that need attention. Story 33. I have patients that repeatedly see allergists and pulmonary specialists because they don't know why I am wheezy all the time and it feels like I can't breathe. They use nasal sprays, antihistamines, allergy pills, and 3 to 4 different nebulizers, all while denying that they vape. It's disturbing. Story 34. Not sleeping enough. Sleep is very important. As a nurse and a patient with sleep issues, sleep deprivation can affect you in many different ways. Story 35. You are an important part of your healthcare team. They cannot do it without you. Please be an active participant, as it improves your overall health. Take the entire antibiotic prescription. Complete the physical therapy exercises and do the homework assigned by your physical therapist. Wash your hands thoroughly. Do not touch your face or open wounds without washing your hands. It is okay to use assistive devices. Making basic life tasks easier for yourself is not a sign of weakness. There are many useful resources available for these types of devices. Medical masks are recommended since many people do not have paid leave when they are sick, or they might be experiencing allergies. Additionally, consider bringing someone with you to take notes or ask any questions if you feel overwhelmed or if information seems unclear later. A reliable note-taker can be very helpful, as well as reminders that you will understand when feeling stressed. Story 36. I work in public health and closely collaborate with our medical director. One of the main reasons people get sick is that they do not wash their hands thoroughly and regularly. Story 37. Just because a health condition is common in your family does not make it acceptable to have that condition. For example, a young woman from a family where everyone has type 2 diabetes gets diagnosed with gestational diabetes, but ignores it because it is seen as typical in her family. She is repeatedly advised to monitor her blood glucose levels and keep them under a specific threshold with the insulin prescribed, as high blood sugar levels are harmful not only to her but also to her fetus. Despite receiving extensive education on this issue and being specifically told that her baby could die if she is not vigilant, she continues to disregard the advice. Unfortunately, this leads to a stillbirth. This is senseless and avoidable. Story 38. I could go to a doctor with an axe in my head, and the first things he would tell me are to avoid smoking, exercise more, and eat healthier. What is often overlooked is that I think we should sleep more and work less. Story 39. Most causes are ordinary. Diets that are slightly lacking in nutrients accumulate over time. Getting just a little too little sleep drains your energy. The time since your last workout has been a bit too long. The air quality in your neighborhood is somewhat polluted. Small issues accumulate over the years and decades to eventually affect your well-being. The insidious part is that it happens so slowly, you do not notice until you compare yourself to someone else. You do not suddenly develop bronchitis. It is a decade of living next to a busy, dusty highway that gradually irritates your child's more sensitive lungs. Story 40. I am someone who works outdoors, but the number of people who collapse and become disoriented in hot weather after drinking excessive amounts of water without consuming salt is concerning. Stay hydrated by drinking water, have a packet of chips, and take breaks when working in direct sunlight. Story 41. Brush your teeth. If you have a stomach virus or any condition that causes vomiting and diarrhea, try to stay hydrated with fluids. Crackers or plain toast can help, but water is especially important. You lose more fluids through vomiting and diarrhea than you might think. Broth, soup, and tea are great ways to rehydrate your body. This is especially important for children, individuals with illnesses, and the elderly. Check your breasts or testicles regularly for knots and lumps. If you have any concerns, consult your doctor. Anyone can develop breast cancer. The same applies to moles. Any changes in size, shape, or sudden discharge should be examined. Skin cancer can affect anyone, regardless of their skin color. Animal bites and scratches should be rinsed under clean water. Applying disinfectant is even better. If the area becomes red, warm, or swollen, seek urgent care. You don't want to risk serious complications from a cat scratch. Try to maintain a sleep schedule and aim for 7 to 8 hours of continuous sleep. Your future self will thank you. Story 42. Hand hygiene. The number of people I have seen walk out of a public bathroom without washing their hands is astonishing. We touch public surfaces all day long. At least apply some hand sanitizer to your hands. Story 43. Stop changing your medications independently. Most of the time, you are only harming yourself. Occasionally, you may be placing yourself at serious risk of a significant medical event. Please do not do this for your own well-being. Story 44. Taking too much over-the-counter medication can have serious consequences. Taking more ibuprofen does not make the pain go away faster. It can harm your kidneys over time. Dialysis is a life-changing and costly treatment that you want to avoid. If you find yourself needing to take ibuprofen consistently for 2 weeks, it is important to see a doctor, as ibuprofen may no longer be effective and a deeper issue could be present. Tylenol or acetaminophen is the most frequently overdosed medication. It breaks down into a toxic byproduct that can damage your liver. This byproduct accumulates when you exceed the prescribed dose and takes a long time to clear from your system, potentially leading to more liver damage. Additionally, unless prescribed by a doctor, you should not need medications such as esomeprazole, lansoprazole, or omeprazole for more than a 2-week course. If your symptoms persist beyond that period, you should consult your doctor to investigate the underlying cause of your heartburn. Story 45. A sedentary lifestyle characterized by sitting all day at a desk, in front of the television, or in bed, and not moving the body enough can lead to musculoskeletal issues, heart problems, and decreased longevity later in life. Story 46. Not getting enough sleep can have significant effects on your health. Just because you have been getting by on 6 hours of sleep for years and feel fine does not mean the lack of sleep isn't affecting you. Story 47. Reusing a contaminated disposable toothbrush after being treated for thrush is concerning due to the cost of the toothbrush. Reusing a sex toy without cleaning it after being treated for bacterial vaginosis raises similar concerns. They were treated 6 times in 18 months. Story 48. Not washing hands before touching and eating food can be harmful. Before grabbing those chips, wash your hands with soap and water or use hand sanitizer. Story 49. We are observing a higher number of non-alcoholic fatty liver disease cases due to individuals consuming excessive amounts of sugar, fat, and calories. What people do not realize is that unmanaged non-alcoholic fatty liver disease can lead to serious liver damage, such as cirrhosis, and ultimately result in death. Story 50. Not washing your hands is the single most effective way to prevent the spread of infection. Before you eat, after using the bathroom, after going to the store, after touching things outside, before touching a baby, after touching a baby, after you come home from shopping, after playing outside, and after taking out the trash, wash your hands. Story 51. Severe heart problems caused by poor oral hygiene can occur. Not brushing your teeth can lead to pericarditis by allowing bacteria from the mouth to enter the bloodstream. While this is not common, it can happen. Story 52. Society does not understand food and the poor quality of what we are sold to put in our bodies. Instead of being educated about nutrition, we accept chronic illness and medication as the norm. Story 53. Cigarettes. I know we mention it often enough that people might tune it out, but the number of amputations due to smoking is alarming. Some lose a leg and then go straight out to smoke after surgery. They return 2 years later to have the next leg amputated. Story 54. Tick bites can be difficult to manage, and it's important to remove the entire tick. Ensure that the head is completely removed. If you develop a bullseye rash, you will require antibiotics for a prolonged period. Story 55. Diabetes is a challenging disease to manage for anyone, particularly for those with lower socioeconomic status. Asking anyone to check their blood sugar levels 5 times a day, manage multiple medications, take insulin, and follow up with their physician every 3 months is difficult. It becomes even worse when individuals lack access to medications, cannot afford them, or do not understand their purpose. Additionally, many people do not experience symptoms from high blood sugar levels, leading them to believe that diabetes is not a concern. Diabetes can lead to severe complications such as renal disease, blindness, diabetic foot ulcers, and severe neuropathy. Managing these challenges becomes increasingly difficult when life is already hard. I wish I could address obesity, as it affects nearly everyone in my area of the United States. This condition leads to numerous untreated health issues, including obstructive sleep apnea, heart failure, hypoventilation syndrome, pulmonary hypertension, and metabolic disorders. Furthermore, it can hinder one's ability to care for themselves, resulting in unclean wounds and other complications. Unfortunately, many are reluctant to take accountability for their weight, even when it contributes to various health problems. Story 56. Patients are cutting their toenails incorrectly. Many people believe that if they have a slightly ingrown toenail, they should try to cut out the ingrown portion by clipping at a sharp angle or curve at the corners. However, this approach often worsens the condition. Instead, they should clip the nail straight across. Story 57. Not using available safety equipment and not buckling seatbelts is a major concern. It is so easy. Seatbelts have been standard in every new car sold since 1968. However, many people are being thrown around and ejected from crashes that they could have survived if they had been buckled in. As I work in the United States, unsecured firearms and firearms easily accessible to persons under the influence is another significant issue. The number of individuals I have assisted whose gun accidentally went off while they were cleaning it is alarming. Additionally, the number of people I have cared for who were shot while they and/or the shooter were intoxicated is horrifying. Story 58. Sometimes a patient will have been on the unit for 3 days, and I haven't seen them take a sip of water the entire time I've known them. And then they say they don't feel well. Please, just drink some water. Story 59. Keep a list of your medications and understand their purposes. It is not sufficient to simply store this information on a computer. Medications you haven't taken for 5 years, along with those prescribed by other doctors, can become mixed up. Have a clear idea of what each medication is for. Arriving at the hospital with low blood sugar while being unaware that you are on medication for diabetes is concerning. Determine your medical power of attorney now, discuss end-of-life decisions with your family, and consider creating an advance directive. I have had many patients placed on breathing tubes who were facing multi-organ failure or untreatable advanced cancer, while family members express hope for a miracle. Meanwhile, I am forced to subject these patients to feeding tubes, procedures, scans, blood draws, and limited pain medication, only for them to suffer and ultimately pass away in pain. Story 60. For young bachelors with only a single dishcloth, the number of guys cleaning a kitchen and dishes with a cloth covered in bacteria is concerning. Often, it is even slimy. This contributes to the average cold. Story 61. Dental health is important. Flossing is essential for effectively cleaning between your teeth. Neglecting to clean that area can lead to cavities, which may require fillings or more serious treatments. Save yourself from costly dental bills by taking an extra 5 minutes to floss each night. Story 62. 3 billion people have iron deficiency. Generally, if you consume meat, live in a wealthy country, and are male, you should be fine. However, I fit all those criteria and was still deficient. Anyone else has a significant chance of being iron deficient. Get tested. Recent research indicates that ferritin levels should be maintained above 100, as that is the threshold at which no one is considered deficient. I was deficient at 72, while the standard minimum is 30. Story 63. I stopped going to physical therapy because it was uncomfortable or my therapist asked me too many questions. I literally had someone transfer for me, and this was their stated reason why. Story 64. Snoring is not just a funny sound you make at night. Obstructive sleep apnea can significantly impact your life. It can lead to serious health issues such as heart failure, heart attack, stroke, and high blood pressure, as well as increase the risk of motor vehicle accidents due to fatigue. The continuous positive airway pressure device or bilevel positive airway pressure device might appear unappealing, but please do not shorten your life by neglecting a medical evaluation or prescribed treatment. Story 65. Wound care nurse here. Please maintain good hygiene and monitor your skin. If your feet feel cold or you experience swelling in your legs, consult a cardiologist for circulation tests. Moisturize any dry skin before it becomes severely dry and leads to more open wounds. If you develop calluses, file them down gently and regularly before they become thick and difficult to manage. Individuals with diabetes should clean and check their feet daily for any open areas. Regular appointments with a podiatrist for toenail and foot care are essential. Story 66. Nurse here. Not sick per se, but a lack of mobility over time will slow you down and eventually lead to serious health issues. We live a very sedentary lifestyle. If you can't get down on the floor and get up properly in your 30s or 40s, it will be impossible to do so in your 60s or 70s. A lack of mobility is what causes you to struggle with standing on your own, bending down to pick something up, or using a toilet independently. So if you want to be able to do those things later in life, you need to start preparing for it in early to midlife. Story 67. Not a professional, but a medical enthusiast. Diet plays a significant role in overall health both in the short and long term, especially for those who are lactose intolerant and choose to ignore their body's signs of discomfort. Story 68. Wiping incorrectly can lead to urinary tract infections, which may turn into serious infections that can damage your kidneys. In elderly individuals, these infections can cause confusion. Story 69. If you have nails, please clean under them. I often see patients who neglect this and then ask for help, only to scratch with dirty nails or use them to pick their teeth. Also, remember to brush your teeth daily. I recall a patient who, when I offered help with brushing his teeth, replied, "Why? I already brushed last week." Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.